Hi again. In this blog, I want to talk about multi-hands treatment that I've kind of referenced and referred to in prior blogs, but I wanted to spell out exactly what this is and why it's so important. Now, we know in terms of craniosacral therapy, which is a very simple technique that individual practitioners can do, we train a practitioner to feel the head and the body and feel where there's a very subtle movement of cerebral spinal fluid, which allows the head to move in and out in a very subtle way in the body. And by palpating or listening to the craniosacral rhythm, we can actually get some beneficial change because we're listening to the body and the head and finding out where there are restrictions. And where there are restrictions, we can do a series of techniques, which are craniosacral techniques, to allow the body to move more easily. And basically, from a structural point of view, if there's more ease, there's an increase in functionality. So we've had some very good results over the last 30 years treating a variety of symptoms with craniosacral therapy. Now, where this concept of multi-hands therapy came into play is that even very early in the mid-1970s, when Dr. Upledger was doing pioneering work in Michigan State University in Lansing, Michigan, he found that with autistic kids, you can imagine a kid that's very active flailing around with all the arms and hands flailing in different directions. He found that when there were many hands on the same patient, that could help actually connect with the body in a deeper and more profound way and allow those restrictions, which are, again, in the case of autism, as we've mentioned, can be considerable, to be released more quickly. So that's kind of the background and the concept of this. And we found that this has been very useful many, many times in accelerating recovery. So as Dr. Upledger founded the Upledger Institute in Palm Beach Gardens in 1985, very shortly thereafter, he created what's called this intensive program. The original name for it was the Brain and Spinal Cord Institute. Now we call it the intensive program. And basically what we found is we put a collection of therapists together, maybe one therapist, 2, 3, 4, 5, sometimes all of them on the same person at the same time, and do concentrated work over 1 day, 5 days, or even 10 days, maybe even 2 weeks in a row with a break over the weekend. We found historically that we've been able to generate some very, very effective results. Again, not in all cases, but in many cases we've seen profound change, especially with patients that get some benefit from individual treatment. But when you add the afterburner, so to speak, of multi-hands treatment, you get an acceleration or sometimes a breakthrough in results where there's been resistance and, something is needed to have a breakthrough in a more profound way. So we started classically in kids with autism, birth difficulties. We've worked also to a very great degree with closed-end injury, people with immune system problems, spinal cord problems, and then even more recently over the past few years, working with soldiers with post-traumatic stress syndrome. And even in terms of our original research program with PTSD with Vietnam vets, and more recently with Afghani and Iraqi vets. Had some very good results with that. And then even more recently with concussion injuries, like the Ricky Williams program and working with NFL programs. I've been involved in that program. Very profound to see what professional sports concussions and how craniosacral therapy can help with that. So as an add-on to these decades of research and experience, we're adding to that intensive programs for Alzheimer's and dementia. Because we found, based on our clinical experience with these other programs, if we can indeed roll back the symptoms of sometimes very severe neurological damage, we can see improvement. So that's another quiver in our bow, so to speak, or another resource that we can use in the treatment of patients that have memory problems. Or if someone's at risk, certainly then rolling back the symptoms before it becomes even a further problem. And if someone's already further down the pike, right now we're doing research on areas of early to mid-stage dementia, and even in mid-stage dementia feel that we can make a difference in stopping and slowing the progression and hopefully reversing and bringing things back to an earlier stage. So all this is part and parcel of this multi-hands program, yet another resource. And I wanted to spend a little time giving you a definition of what exactly this is and how this can be of help. And again, info@preventingalzheimers.com if you'd like to know more about this multi-hands program. We're doing something called mini intensives that we do not just in Florida, but around the country, where we do a mini version of this as well, where people can even come for a couple of hours, up to 3 days in a row, and gain the benefit. And that we found to be helpful as well. So thanks for listening to this, and talk with you again soon.